Welcome back. Today we are doing the 24 to 27 week update. I think I did 20 to 24 last time, but I may have been in the middle of my 24th week. I don't know. My phone, I have 24 to 27 week update. So I'm also having some heartburn as we speak. I'm going to start like usual with the what to expect when you're expecting app, and we'll see kind of where we're at. It says baby is as big as a head of cabbage. Interesting. It also says that the baby can hear you, but the sound is still a little bit muffled right now. Also states that the baby has hiccups, which I can feel. At least I think that's what it is, when you just kind of feel that almost like thumping in rhythm. I think that is hiccups. And then it also says that baby has started to develop muscle tone from kicking. And guys, right now the uterus is at my rib cage, so she can reach. And this is the least part of pregnancy that I like, just because it's just the most odd feeling when they start kicking and it hits your ribs. It doesn't hurt, but it's just like, it's uncomfortable. It just feels really strange, and I don't know. And like, that's like my tickle area. I don't know. So that's what's going on via the app. And it says that she should be as big as 2 pounds with 14.5 inches. I have another growth scan in, I believe, 2 weeks from now, maybe. So I'll have another kind of weight measurement, like estimate, in the next video. So I'm going to try to run through this very quickly. Side note, look how cute this mama sweater is. I got this from my friend Clarissa's shop, Closet Chic Boutique. She has a storefront in Missouri near the Ozarks. But she also has a YouTube channel, Clarissa Peterson. She used to be called The New Mom, but yeah, she's a boutique now on this. I just love this sweater. I said I was gonna buy it and just put it in the hospital bag, but I had to wear it. So I had to point that out. Anyway, so let's go ahead and just start with like the randoms. If you're new here, I do the most casual updates possible. First thing, pregnancy cravings. Nothing has changed there. Strawberries and French toast have just been my go-to. I have just been buying strawberries after strawberries, cutting them up, throwing them in a bowl and eating them. I have actually had a strawberry smoothie, which seemed to help the craving, and I'm still eating French toast whenever I feel like getting up in the morning and actually cooking. I will make French toast sometimes. I've kind of been like scaling back on it because it's not really the healthiest option, and I have a glucose test coming up and I'm very nervous that I'm gonna fail it. But those have been very consistent pregnancy cravings this pregnancy. Also, this is baby laundry, like some of Winnie's stuff we're giving her, and then some other stuff that's like newer on the hanger, and then the kids are actually home playing in the other room. So this is kind of like the most, it could turn into a very chaotic video, so I'm trying to get through this very quickly. As far as symptoms go, heartburn, obviously, it actually subsided week 24, 25, I want to say 26 even. It just came back. Like, all of a sudden I hit 27 weeks and it came back with a vengeance, and it's painful. So I was able to kind of scale back on the Pepcid a little bit. Now I'm back to taking it when I eat things that I know are going to trigger it. I was like, great, I'm growing out of that and we're moving on. No, it's back. So sciatic pain still here. Very, very painful pain. Like, I don't know what's worse, the heartburn, the kicking of the ribs, or the sciatic pain. Again, I'm very grateful for an overall healthy pregnancy, but if we're talking symptoms, they're not my favorite symptoms to have. Anything else as far as like movement, I still feel that I'm starting to have not only the sciatic pain, but I'm starting to have leg pain. And when I say leg pain, I mean pain that kind of radiates from my pelvis, like down into like my quadriceps and my my inner thighs. And we were actually at a ball game, I was like 27-1, 27-2, I think, and I was like waddling because I was having the world's worst pain. I'm like, what is the deal with this leg pain? And it was just super uncomfortable. We'd actually stood a whole lot during that 2-day period, and I think that triggered it. Once I was able to actually get rest and I had a day off of work also, it was just like it reset, and I haven't had it since then. But I was kind of thinking, I hope this is not going to stick around for a while, because it was actually painful to walk. And then the last symptom, I would say, Braxton Hicks contractions. I've had a few come in sync, 4, 5, 6 minutes apart for like almost an hour. And I'm in my head, I'm thinking, I hope these are Braxton Hicks, because if you guys remember correctly, I went into preterm labor with my twins around this time. I believe I was a little bit farther. I want to say 28 and 4, 28 and 6. I can't remember exactly when it was, but it was around this time that I went into preterm labor with them, and that is kind of how I remember it starting, feeling like it was Braxton Hicks, but then it was actually like continuing to come along. I had to be admitted overnight. They gave me a medicine called Precardia, and I had the steroid shots. And in my mind, I'm like, well, they were twins, so it's different, but I guess I really don't know the answer to that. If I was at a higher risk because I had twins, I'm not really sure. It doesn't seem like having gastroschisis with her would contribute to preterm labor, but then again, every pregnancy is different. It's like you never know what you're gonna get. Okay, so I told you guys it's gonna be a little bit chaotic. Okay, anything else before I get to the appointment? I think that kind of covers all the things. I have not looked at my weight gain yet. I need to look at it. By the end of this, you guys will know how much I gained overall. I'll give you guys like a start and finish type scenario. But let's talk about the important thing that happened over these past couple of weeks. It is the echocardiogram, which is a heart ultrasound. They did this because of her gastroschisis. I hope you guys can't hear them yelling. They did it because of her gastroschisis. They just want to check. Sometimes defects can kind of go hand in hand, is what I'm understanding. They weren't really worried about it, so they told me not to worry about it. Of course I'm worried. I've been worried since day one of finding out all these things are going on. But they didn't seem concerned that they were actually going to find something. They were doing it more as like a precautionary type thing. I don't know. I was still a little bit nervous. So I went in for the ultrasound. They checked everything from like the opening and closing of the valves, the pulmonary veins, the chambers, you know, all the things of the heart and the blood flow and things like that. And everything looked great. So I'm happy to report that as of right now, there's nothing in the heart they are concerned about. Of course, there are defects of the heart they cannot necessarily see until after baby is born. Even up to a few months old, there are certain defects that they cannot diagnose, and so some of them are very just hard to see. So I would say that not even just me, but anyone pregnant is not out of the woods for heart defects until, you know, that time passes once baby is born. But right now, that was a win. That was a win day for us, and so very happy. As far as her organs, as of right now, still just the small bowel is on the outside. We did have a new fear unlocked for us. This physician that we saw this time, he's a locum tenens that travels, and ironically, he is also an expert who does like forensic testimony as well. He saw my job and was like, oh, I work in forensics, you know, and kind of do this for a trial. I'm like, oh, that's very interesting. So a very, very nice guy who kind of travels here and works and then leaves and comes back. But he unlocked the new fear of something called vanishing gastroschisis. And I had not really been told about this. I had not really looked it up. But of course, I immediately was like intrigued to hear what he had to say. And he was just bringing this up as something that he would be concerned about if he saw it, even though he did not. Basically, we were in the room. He was giving us the ultrasound results for that day of the echocardiogram and, of course, what the abdomen looked like. And he was like, you know, this is great. Just the small bowel's out. I see no dilation. Also something great. The fluid levels look good. Also great until I'm like, yay, this is great. I'm very, very happy with this appointment. Another win for us. And then I just asked him, you know, like, what are the chances? You know, is there a percentage chance that we have that maybe the stomach will start to come out or anything else coming out? Are we pretty on track with just having to deal with intestines out once she's born. And he said that he honestly was not even worried if the stomach were to come out. That's like the least of his concerns because it's so common. He said that he's more concerned about if, and he doesn't see it at all, but if he saw dilation, basically indicating an obstruction or vanishing gastroschisis, meaning that the defect tries to heal itself and closes. If that were to happen, he said typically the guess they can see it on ultrasound, but the problem with that is if it closes, it strangles the bowel on the outside, causing death of the bowel essentially. That is a very, very big problem. In the group I am in on Facebook, I went in there, typed that in, and of course saw these stories, and I'm like, oh my gosh, that is a very, very scary thing. So a whole new fear became unlocked for me. I really want her defect, her little hole, to stay open in her stomach because I don't want there to be any death of any bowel on the outside. I know he was just telling us that so we're not blindsided if that were to come up. It doesn't seem to be as common as other things like, you know, just slight dilation or other organs coming out. So really, if you had to pick one, you'd want the other organs to come out and not the hole to close. So it's like I learned something new at every appointment. And yeah, so that's crazy. I was like, okay, so something else I need to now put in the back of my mind to worry about. And he just said that he was just letting us know that we're putting a lot of fear in other organs coming out, but we shouldn't be worried about that necessarily. So he eased one anxiety and caused another. Bless his heart. Very nice doctor. I feel just very well taken care of at this clinic though. So that is the pregnancy update. I don't have anything crazy new, but great news as far as the last appointment. So in the next pregnancy update, we will have what will we have? We will have the glucose test results. We will have her next growth scan. We will also have the meeting with the pediatric surgeon. So the next update is going to be like a really, really big update with all of that in there. So glucose results, surgeon meeting, and what else did I just say? Growth scan. So I'm hitting the point of pregnancy right now where they warned me that her growth is probably going to stop with the curve and start to decrease. And so I'm looking forward to obviously to seeing her again. We did get to see her in 3D last time. They surprised me and just like flipped it to 3D, and I'm like, oh my gosh, this is her face. It is crazy. She looks just like Luke, which it's crazy to me that I can even see that in the utero. I don't know. She was turned the perfect angle when the camera flipped to 3D, and I was like, oh my gosh, that's Luke. But yes, as of right now, she's still great in the average percentile, but they warned me that it's going to start dropping. And so I'm just curious to see how it's going to go as far as, is she going to have a major drop? Is it going to be a little bit? Is she going to be able to hang on for a while? Her size is very, very important because she has to be big enough for her organs to fit back inside. Because best case scenario, they can put them in right after she's born. So, yeah, that is the update, and I'm very happy. This is a great update, and I don't want to take this for granted at all. I do want to know what videos that you guys want to see coming up, though. Besides the pregnancy updates, I'm getting 3-4 weeks away from having to pack a hospital bag. I was told by them to pack between 30-32 weeks. So that's like 3-4 weeks away. So do you guys want to see a hospital bag video? Do you even care? I already have one up from the twins. What other videos towards end of pregnancy do you guys want to see? Because I'm willing to put some out there mixed with some days in the life. But yeah, I'm out of breath. Do you guys want to see? I don't know if it's changed much. Legs are asleep. It hasn't changed much. Well, this is obviously a sweater. This is my almost 28 weeks. And it's kind of hard to see because of that chair in the background. But here is my 27.5, basically 2 days from 28 week bump. And yeah, that's going to be all for this video, guys, and I will see you next time. Bye.